Hi, say chaps, I am Neha. Welcome you all to Something More to Say. Today I have come back with the informative news for you all. Fortis Healthcare adopts Microsoft Teams to continue providing care virtually. Virtual visits on Team reduces COVID-19 risk for both patients and doctors. We never give up on our patients. That's our mission to save and enrich lives, says Dr. Ashutosh Raghuvanshi, Managing Director and CEO, Fortis Healthcare. Never has this mission been more pronounced in Fortis Healthcare's 2-decade history than it is now. As the COVID-19 lockdowns impacted physically visits across the country, Fortis Healthcare began looking for ways to still care for its patients without putting them at risk the hospital visit entails. Established in 2001, Fortis Healthcare is one of the India's largest health services providers, serving 2.5 million people annually via its network of 28 hospitals, over 410 diagnostic centers, and 9,000 potential beds spread across India metro cities. The COVID-19 outbreak possessed an entirely new challenge to institution. It was very important for us that we continue to provide care to our patients, says Ajay Viji, CIO, Fortis Healthcare. At the same time, we did not want them to come at risking to the hospital unless it's unavoidable circumstances. It not only puts the patients at risk, but also the doctors and frontline staff who are working at the hospital. Indian medical laws forbade hospitals to provide virtual consultations to patients, but they had to relax the rules due to the COVID-19 pandemic. To ensure continuity in serving their patients, Fortis Healthcare worked with Microsoft to deploy virtual visits on Teams. This enables patients to connect with doctors without having to step out of their homes. It took the team at Fortis Healthcare just 4 days to implement Teams and start taking appointments from patients. In essential services, healthcare is at the top of pyramid in the current health crisis, says Jasrita Deed, Head of Brand Marketing and CSR, Fortis Healthcare. We went live with the system as soon as we could, and all consultations were free for the first few days. There was no question of delaying and launch of the platform. Microsoft Teams is HIPAA complement, which ensures all patients' information is managed privately and securely. The doctor will see you now virtually. To minimize inconvenience to its patients, Fortis Healthcare integrated telephonic and video consultations via Teams with their existing booking system. Patients book their appointments as usual, but they now receive an URL along with the time of the appointment. And they all need to do is click on the link at the time of the appointment to talk to their doctor on Teams. Earlier, one would come on our website or app or called out center to the book of physical consultation. The only thing that has changed is now we get the option to the book a video or teleconsultant based on their preference. Dir explains. Depending on their case history, patients are asked to share diagnosed or other reports securely before the appointment. The doctor sees the patient, writes the prescription as usual, which is shared to the patient digitally. Teams has enabled our doctors who don't need to be at the hospital to continue seeing their patients from their home, which reduces their risk of getting infected, adds Vijay. In this new world order, we won't wait our patients to unnecessarily be exposed to infections. Our online video consults with the help of Microsoft Teams are a blessing. Dr. Meenakshi Aju, Director, Obstetrics and Gynecology, Fortis La Femme. Doctors at Fortis Healthcare echo the sentiment. For instance, obstetricians still have to go to the hospital to deliver babies, but they don't have to physically see patients in their first or second trimester in most cases. With Teams, They have to be able to reduce the risk of exposure both for themselves and expecting mothers. Dr. Meenakshi Aju, Director Obstetrics and Gynecology, Fortis La Femme, opines, in this new world order, where we don't want our patients to be unnecessarily be exposed to the infections, our online video consults with the help of Microsoft Teams are a blessing. Most problems, including hormonal, abnormal uterine issues, can be sorted on these consultations. And our advice, prescriptions, and investigations are mailed to the patients only if physical presence is required. We call in the patient for an examination. Therefore, visits to the hospital are reduced. In fact, even in pregnancy, the earlier pregnancy checkup and counseling can be done by us with the patient and her partner in the comfort of their homes. As they say, necessity and the mother of invention. And these online consultation systems are bound to stay with us for a long time. During COVID-19, a lot of focus has shifted to the mental health concerns of a population under lockdown. Teleconsultations have been a huge help during the lockdown crisis. It has helped patients, especially in chronic care specialties like mental health, allowing the maintenance and continuation of treatment process, which is so vital to the well-being of patients. Teleconsultations will also be help to the people to stay at home, be safe. And at the same time, we are able to connect to the psychiatrist and their psychologist and continue with their treatment, both from safety and health point of view. This has been very positive initiative by the government to allow teleconsultations. Our team has been using Microsoft Teams and found it out to be a user-friendly platform. And for us, confidently and privacy, our teams helped us with that, says Dr. Samir Parikh, Director, Mental Health and Behavioral Sciences, Fortis Healthcare. We have also conducted live events through Teams, and it has helped us reach out to the wider population to raise awareness on mental health issues. I feel live events on the Microsoft Teams is a very easy, good way to reach to the maximum audience, he added. Since deploying Teams in the last week of March, Fortis Healthcare has done more than 12,000 consultations virtually. In our endeavor to sustain our fight against the spread of COVID-19, we are bringing the expertise of our doctors to help you with their health issues right in their comfort of your home. As their protective lockdown was necessary to fight off this pandemic, it must be an excuse to delay any health consultations that our patients wanted to avail, and hence, this is a solution we believe. This is helpful for the patients as their families without risking the much needed social distancing for the patients and doctors and the healthcare staff, adds Dr. Raghuvanshi, the Managing Director and CEO of Fortis Healthcare. However, in emergency cases, we our clinicians feel it's necessary to physically examine the patient. E-consultations are not given in those cases, and in hospital consent, where doctor can do a physical examination is suggested. These are the cases which require intimate and urgent medical intervention. The normal for healthcare, will authorities have relaxed laws on virtual consultations to ensure people have the access to doctors during the current situation. Healthcare providers like Fortis hope it continues in the post of COVID-19 world too, as they see numerous benefits, including making quality healthcare accessible to everyone. As we all adopt to the new post-COVID-19 normal, maybe virtual healthcare will fit right into the plan. For more updates like these, stay tuned to Something More to Say, and don't forget to like, share and subscribe to our channel. Till then, bye all.